Hello, my name is Katie Stewart and this is a presentation on human immunity. An infection is an invasion of the body. It is caused by microorganisms coming into the body. The body has to fight against the infection, which is caused by bacteria, viruses or parasites. They are transmitted in various different ways like direct contact, indirect contact, insect bites and even contaminated food. The body has 3 lines of defense for infections. They are categorized into non-specific and specific responses. The first line of defense the body has is the skin, which is a physical barrier. It is part of an integumentary system and has 3 layers: the epidermis, which is the outermost layer, the dermis, which lies underneath, and lastly the subcutaneous layer, which can be found deep down. The skin is an important barrier as it protects against the environment we put ourselves in, for example using melanin to protect us from the sun. It prevents, impedes and stops penetration of microbial organisms, chemical irritants and toxins. The skin needs to stay unbroken for this to happen and to remain a strong defence. Then there is the mucous membrane that lines the eyes, the ears, the nose, the sinuses, the mouth, the throat, the GI tract, the respiratory tract, urogenital tract and lastly the vaginal tract. Mucous membranes will be coated in a secretion that helps to fight against infections like pathogens and allergens from entering the body. Like all barriers, the mucous membrane can be compromised and there could be many reasons for this, but one typical reason is that the first line of defense is already compromised. If pathogens enter the body and make it to the digestive system, then it will come up against a series of barriers such as stomach acid, pancreatic enzymes, bile and intestinal secretion. The acid that is found in the digestive tract is extremely powerful in protecting the body from infections. Along with chemicals, there is also the contraction of the intestines and the shredding of the cells that help remove the dead microorganisms. Then there are the nasal cavities and airways. These are protected by the mucous membrane, which catches pathogens as they try to enter the body. The removal of pathogens is helped by the cilia hairs. They move rhythmically, which moves the mucus and pathogens away from the lungs. Then, the urinary tract is very effective in protecting against infections. The bladder is protected by the urethra, which drains the urine from the body. In males, the length of the urethra helps to move bacteria down the bladder frequently, helping to wash out bacteria and pathogens as it's much longer. Women are more prone to infections in this area as their urethra is shorter, allowing bacteria to enter easier. During pregnancy, the bladder has little protection and women are more likely to get UTIs, but the vagina is very acidic with a pH level around 4.5, which helps to fight the bacteria that enters the body. One of the second lines of defense includes inflammation. 4 events happen for inflammation to occur. Blood circulation is increased in the area affected. The cells around the area that are infected develop gaps, allowing blood cells to pass through. Then various congregate around the affected area. This adds to the inflammation, but also brings proteins to the area which fuel the immune system's response. The heat that the body creates when fighting infection acts as an antibiotic. The area that is infected will start to change in appearance. It will become red, swollen, and be hot to touch. Phagocytosis is when defective or inverse cells are destroyed. When inflammation happens, monocytes need to change in order to become macrophages, which target cells that need eliminating. Macrophages are an important part of the immune system and are formed by differentiation of white blood cells called monocytes. The monocytes leave the bloodstream and find the infected area. During this journey, they turn into macrophages. When they engulf the infected cells, the cellular enzymes destroy the cells. They have various functions all around the body and are sometimes called different names depending on where they are found. Cytokines are proteins which help the immune system. The role of the cytokine is the signals and to mediate the inflammation and immunity. A few examples of these are interleukin, monokines, lymphokines and interferons. The general travel in an inactive state, travelling around the body waiting to be triggered. Once activated, they form a cascade reaction which attracts phagocytes, which removes particles and starts the inflammation process. Pathogens are infectious agents. They can be either bacteria or viruses, along with protozoans and fungi. Bacteria is extremely small and cannot be seen by the naked eye. Viruses are even smaller. They are not living and need a host in order to survive. Protozoans and fungi are less common but can still cause illnesses such as malaria. Then you have antigens, which are the part of the pathogen that tells the body is being attacked and starts the immune response. A battle that the body is up against is the fact that it needs the antigens to infect the body in order to know to stop the infection. Acquired immunity is something that the body learns over time. It happens when the body is exposed to certain environments and the immune system encounters antigens from the environment. The body will then build up a defense to the antigens, which can be used over and over again. The main function of acquired immunity is to learn, adapt, and remember. Acquired immunity is where the body is exposed. Active immunity is where the body is exposed to an antigen on purpose, for example, in a vaccine. Passively, where pre-formed antibodies are given to the body so it is protected before it encounters the antigen. Natural acquired immunity is where the body exposes itself to the antigen on its own without medical intervention. The immune system will work to fight off the disease and then develop a memory of it. For the immune system to work, leukocytes need to be present. They are often called white blood cells. They are made up of 5 different types of cells and are produced in the bone marrow. They are neutrophils, which are the most common and the first to reach an infected area. Lymphocytes are very small and part of the body antibody production. Monocytes are the largest and turn into macrophages, and exiting the bloodstream is their main job to eat the dead cells. Eosinophils are rare and help with the allergens and worm infestations, and basophils are the rarest of them all. Not much is known about the function of these, but they do contain histamine, which dilates the blood cell vessels, allowing more cells to reach the infection. Lymphocytes are a part of the acquired immune system, and there are 2 types, T cells and B cells. The T cells are very common, and there are 3 types: cytotoxin, suppressors, and the helpers. They are part of the destruction cells that are infested or damaged. The T cells signal for the growth and activation of B cells, activate eating cells, simulate cytotoxic T cells, and signal for growth of cells such as macrophages. Antigen presenting cells, APCs, help T cells to respond to foreign substances, and they are able to communicate via the helper cell. Helper T cells are very common, and they help to regulate an immune system within the body. Cytotoxic T cells help the immune system respond to certain tumours and tissue grafts. They are activated by the APCs and need helper T cells to be present. Suppressor T cells help to protect against autoimmune attacks. B cells release huge numbers of antibodies and present antigens to T cells. Plasma cells are B cells, and they secrete antibodies into the circulatory system. Immunity can only be maintained because of the plasma cells secreting the antibodies. Hemoglobins are also called antibodies, and our proteins are bound to antigens. They are used to target infectious, recruit immune cells, neutralization of toxins, removal of antigens, complement activation, stimulate cells that eat foreign substances, and activate mast cells. They are made up of 4 chains. 2 of the chains have a greater mass than the other 2. They look like a Y shape, as you can see on the slide, and there are a few types of hemoglobin, such as hemoglobin G, which creates complement pathways. It stimulates a direct attack foreign substances in the body. Hemoglobin A, its role is to defend the soft, moist mucal surfaces found in the mouth and throat. Hemoglobin M, the structure for this one is different, as you can see on the slide. It is the first on the synthesis in antibody response. Hemoglobin E is the largest, and if a person is healthy, there won't be many of these in their body. Hemoglobin D are uncommon, and the function is unknown, but it is thought that they work alongside the B cells. Antigens in the body allow the immune system to tell the difference between self and non-self, making sure that only the non-self are attacked. The major histocompatibility complexes 1 and 2 are what help tell the difference between self and non-self. The cells show specific antigens depending on where they are in the body. These antigens tell the immune system whether they are self or non-self. If they are non-self, then the T and B cells are put into play. MHC1 molecules are expressed on the surface of the nucleated cells. The immune system will see this as a warning sign, and if it detects foreign proteins, it will present them to the T cells. The MHC2 are very similar, but they take antigens that extracellular pathogens, such as bacteria. They then go through a process before they are picked up by the T cells. A transplant is a procedure when cells, tissues or organ are taken from one site and used in another. This normally happens person to person. The immune system is a formidable barrier against foreign objects in the body, and special care has to be taken when matching the donor to the patient. If the immune system detects the antigens and sees them as foreign, they will be seen as non-self, and the immune reaction occurs. Monoclonal antibodies can be used during and after surgery to prevent this happening. There are 3 types of rejection, and they are hyperacute rejection, which happens within minutes, acute rejections that can happen weeks after, or chronic rejection, which can take place over many years. Rheumatoid arthritis is where the immune system attacks the joints in the body. It's 4 times more likely in women than men. It causes pain, swelling and stiffness, mainly affects the hands, feet and wrists. It can also cause tiredness and weight loss. The immune system can be worse and then better, and this is known as flare-ups. This is controlled by medication so that it doesn't happen as often. It's unclear what causes rheumatoid arthritis, but women are at a higher risk of getting it, along with people in your family history if a person smokes. There are 3 medication can help relieve symptoms, along with psychotherapy and occupational therapy. Multiple sclerosis, otherwise known as MS. Once it progresses, it can cause serious disabilities. This varies person to person and can reduce the life expectancy of a person. It is where the immune system attacks layers surrounding the nerve cells called yielding sheath. Symptoms are fatigue, difficult walking, bad vision, uncontrollable bladder, stiff muscles, and many more. There are 2 types of MS, relapsing remitting MS, which is the most common. This type of MS has flare-ups, so can be worse on some days than other days. Then there is primary progressive MS, which means symptoms gradually worsen over time and no breaks are in the symptoms. Ways of diagnosing both these diseases are autoantibody tests, anti-nuclear antibody tests, complete blood count, a C-reaction protein, and urocyte sedimentation rate. There are 2 types of active immunity, natural and artificial induced immunity. It is where immunity or resistance is gained to a certain disease and antibodies are created for that particular disease. Natural active immunity is where the body is exposed to a pathogen, and this will start an immune response to attack the pathogen. The T cells attack the pathogen and then show it to the B cells, which will create an antibody to attack the pathogen. The B cells then remember the antibody so that if the body encounters the pathogen again, it can act quicker. Artificially induced native immunity is where a person is injected with a foreign antigen so that the body can produce an antigen to protect the body. It is similar to active immunity, but the person is intentionally exposed before they encounter it naturally. Natural passive immunity is where the antibodies are given to a person via another person. This is done naturally between a mother and a baby during prenatal and postnatal interactions. This can happen during pregnancy, with the maternal blood is passed into the fetal bloodstream. It is also possible for the antibodies to cross through the placenta. This is important as it can protect the baby for up to 4 to 6 months after birth, so that they have time to create their own antibodies and develop their immune system. Artificially induced passive immunity is where a person is injected with antibodies made by a person. This only lasts a few weeks and the body will start to break down the antibodies gradually. This is common for people that want to go on holiday. Vaccines are where the body is intentionally exposed to weakened or harmless pathogens so that the white blood cells can produce antibodies to fight it when the person encounters it for real. Immunological memory, where the immune system can react quicker and more effectively than when it would first encounter the pathogen. The first encounter is the primary response. It takes longer for the body to fight. This can cause the person to have some symptoms. Secondary response is when the pathogen enters the body for a second time and is able to fight the pathogen with the antibodies already made. Live vaccines are wild viruses or bacteria that have been made weaker. They must be replicated the same response when they are vaccinated in the person. Enough of the virus needs to be in the dose in order for it to stimulate an immune response. Some people will have an adverse reaction to this vaccine, but it will be very mild. An inactive vaccine is where the bacteria or virus is grown, then is activated by heating it and adding chemicals. They cannot replicate, therefore they cannot cause disease. They require more doses than a live vaccine, and it cannot take up to 3 doses for an immune response to develop. Immunisation has helped protect against serious diseases all around the world. It has such a great impact on saving lives and will continue to do so. They are so impressive that they have even eradicated some diseases, along with keeping the death rate of children lower, as they are now protected before they enter the world by the mother being vaccinated to pass it on to them. Measles is one of the worst contagious diseases and is spread by coughing and sneezing close to a person. The vaccine was introduced in 1963, but before this there were epidemics every 2 to 3 years, causing 2.6 million deaths a year. It is clear that having a vaccine has been imperative to battling the spread of measles. In 1940, there were 857 deaths, which were dramatically reduced over the years. In 2017, there was only 1 death. In 1994, there was actually no deaths from measles, and this has been reoccurring for many years after. If people continue to have their measles vaccinations, it will continue to control the spread of the disease. Herd immunity is an important way of controlling and eradicating diseases also. Herd immunity is where a higher percentage of people are vaccinated, making it harder for the disease to spread, making the amount of people infected lower. When looking at how many people need to be vaccinated, the scientists will look at the row number. It takes into consideration the high-risk categories, how effective the vaccine is, but how long it lasts and which populations form critical links in transmission. For groups of people that are extremely vulnerable, they may be asked to isolate to keep them safe to a certain number of people who have been vaccinated. The same goes for people who may have the disease in order to keep them spreading it. Although vaccines do an incredible job, there are groups of people that question their safety. For instance, parents are hesitant in giving it to their children. There are also religious groups that are also against the vaccines. Other reasons that people may not be vaccinated are that they are recovering from an illness or because there is too high a demand for seasonal vaccines. As the population increases and lives are busier, pharmacies have now been brought on as listed people that can vaccinate people to help with the vaccination program. In conclusion, the body has many great ways to protect the body from infectious diseases, but with the help of science, we are able to enhance the amount of protection the body has, keeping us alive and healthy for longer. Thank you very much.